The pandemic may have inadvertently sparked a virtual healthcare revolution. More and more people, keeping more and more space from one another, are talking to medical experts online instead of in person. I know I've certainly done that. And that's a trend that seems to be here to stay, with no shortage of companies getting in on the telehealth business. Joining us now is Anjali Kataria, CEO of one of those firms with a rising following. It's called Mytonomy. Anjali is also a former US FDA official, so lots of amazing things to talk with you about today, Anjali. Thanks for being here. Now, I know you call your company the Netflix of healthcare, so I'm wondering what that description means and how your offerings have maybe pivoted a bit during the pandemic.
Great, thanks for having me. We're reinventing how and where people care for themselves now and in the future. So let's take a person living with diabetes, for example. When it comes to managing health, that person will spend 99% of their time caring for themselves at home and less than 1% of their time in a hospital or doctor's office. A person getting ready for a colonoscopy or a knee replacement surgery, or somebody getting ready to go and get their vaccine appointment, will spend more time preparing and learning about their condition and their procedure or treatment than actually getting the procedure. And the problem today is that we haven't really prepared patients for that, to be able to have the right tools and skills and to learn what to do at home. So what Mytonomy is doing is delivering short form video, streaming that content to patients at home in short bites using the brain science of microlearning. And that's where the analogy to Netflix for healthcare comes from.
And I'm wondering, you talk about misinformation, and we heard today that Twitter is really cracking down on misinformation about the COVID vaccine online. So I'd imagine that's something that you hear from a lot of patients, just questions about what this shot does. I'm wondering what strategies you've used to really combat that misinformation, and maybe what some trends are that you've heard from patients as well.
Absolutely. In healthcare, there's so much misinformation, as we've seen with the coronavirus and with the vaccine. And in all condition areas, because we haven't prepared, our health system hasn't really been designed for serving patients at home. We find that when patients go home, they start looking stuff up online, they start talking to people, getting anecdotal information. And that costs our healthcare system a lot of money because of that misinformation. They're not able to fully take care of themselves. When in fact, patients trust their provider. They trust their nursing team, their hospital, their clinic, their doctor. 85% of patients trust their provider. So what we've done at Mytonomy is we've brought their provider right into their living room, from their clinic, their hospital. We're putting healthcare in the palm of the patient's hand, with their own provider and nurse sharing short form instructions and creating a tailored experience across that entire patient journey. As patients are watching content from trusted sources, those they trust the most, and learning, the system, Mytonomy, is learning and giving them additional survey questions and additional content based on their behavior. And this is a big problem. Misinformation is a very big problem across our society today.
Right, and Anjali, I hear you mentioning that the healthcare system just isn't quite set up for patients to get care at home currently, but you also believe that telehealth is here to stay. Can you tell me why you think that's going to be the case, even as we, fingers crossed, move past this pandemic?
Well, before pandemic, we all talked about bringing a more consumer-oriented health system to fray, and to seeing in that foray, seeing a telehealth take off. And it took years and years to get there. Overnight, it seems, during the pandemic, we saw hospitals across the country go from 5 to 6% levels of usage of telehealth to 80 to 85%. Now things have come back down to about 30 to 40%. But I think that's going to stay. I think that's an incredible lift that we've seen, where patients have found that it's convenient for them to be able to quickly get on a call or quickly get onto a video conference, or for elderly patients not to have to travel out and to be able to talk to their doctor from the comfort of their home.
Right, and
I think that's
Anjali,
going to stay, that convenient.
of course,
Yeah.
and very quickly, I'm wondering if you can tell me what you think is the biggest misconception about telehealth care, really quickly.
Well, I think the biggest misconception I'm seeing today around telehealth is that maybe it's not as good, right? It's similar to
Hmm.
what we're hearing about the J&J vaccine, right? Maybe it's not as good as the Moderna or Pfizer, or maybe telehealth isn't as good. And these are myths. I think when you look at telehealth, there are advantages to being more relaxed as a patient, being home. You may have a better conversation with your provider than if you were stressed or late or almost missed your appointment or had to wait a long time. You might be ready to get out the door. You may not be able to process everything they're telling you in the
Right.
appointment. Of course, when you're in the appointment, there's a lot more information that the doctor can get because they're seeing the whole person, right?
Right.
So I think both have advantages and both have a lot of opportunity for delivering very good quality care.
Right. I definitely relate to being late for every doctor's appointment. Anjali, thank you so much for being here. Scarlett?